Thank you, Mr. Chairman. Good afternoon, dear colleagues. These are my disclosures. And the aim of the study was to find out the discontinuation rates and the reasons for discontinuation in our experience in 2 university Spanish hospitals. For this purpose, we include 166 patients, both idiopathic and neurogenic overactive bladder, and this is a retrospective review, including a telephone survey. This telephone survey is just to find the reasons for discontinuation reported by the patient. So we divided the reasons for treatment discontinuation in medical indications, those found in the clinical records, and the patient-reported reasons found during the telephone survey. So our results, we found an improvement rate of 77%, but with a high discontinuation rate of 43%, with no differences between hospitals. And if we analyze the reasons for discontinuation in the medical indications found in the clinical records, the most common were insufficient response to the treatment and some accessibility hospital problems. On the other hand, if we look at the reason for discontinuation in those patients during the telephone survey, we found that insufficient response was the most common reason, and the accessibility hospital problems was the second common reason for discontinuation. We divided the reason in 3 groups. One were the expectations about treatment, second, some accessibility or control problems, and finally, complications. And if we look at the table, the most common reason for discontinuation was expectations about the treatment with onabotulinum toxin. So if we look at the number of repeated injection, we can find that 76% of patients drop out after the first 2 injections. And if we look at the most common complications, intermittent catheterization, only 2 patients disrupted treatment. And if we look at the urinary tract infection, only 5 patients, even being common urinary tract infection, only 5 patients disrupted treatment. So in conclusions, we found a 70% of improvement rate, but with high discontinuation rate of 43%. Most of them regarding to patients' expectation regarding therapy. And we think that more insight is necessary in order to improve adherence to this treatment. Thank you very much.
Could you just explain the last sentence of your conclusion, please? What does it mean?
In the last sentence, of course, we think that there are some patients that objectively are improved after treatment with bladder diary, with questionnaires, but the patients doesn't adhere to treatment, have the discontinuation during the next injections. We have a very high, in all our experience, response rate, but not all the patients continue repeating treatment. We have to look for if it's a question of information, or if it's a question of that repeat treatment is not accepted by all the patients. And we think that it's necessary multi-center, even multicultural, because we think that there are cultural differences between groups and between, of course, regions that may explain some differences in adherence.
Yes.
Hi, Helen Morton, I'm a trainee from the UK. Did you do any sort of qualitative analysis in regards to the telephone follow-up you're doing with them as to what themes patients were saying about the expectations? Was it because they weren't expecting to do things like ISC, or was it because of the actual treatment itself, what they thought it was going to be like?
Well, this telephone survey was self-made, of course, by the investigators. And we tried to, some of the questions were closed, yes or not, regarding to efficacy, regarding to complications, and regarding to some expectations, but other questions were open. So there are a lot of information of that it's impossible to show on a telephone survey. It's a pilot study, first study, and the first approach to this problem, because it's a difficult problem to analyze. And we think that we have to develop a prospective study not taking into account the memory effect of a telephone therapy, because some patients received the treatment even 2 years ago, and there is a memory effect that can affect these results. It's only an exploratory study.
Thank you very much. Oh, sorry, there is another question. We are a little bit short of time, if you don't mind to ask the question during the interruption. Thank you very much.
Thank you.